All right, so we want to actually look at management of what fractures that could actually occur in the pelvic region. So one of these ways in which you can actually manage these fractures is pelvic binding. All right, so pelvic binding, you are basically using something to strap up the pelvic region so that you keep the bones together, you keep the blood vessels together until healing occurs, or until everything is stabilized, before you now what bring in other methods of treatment. So pelvic fractures, especially if it is from high energy trauma, it can lead to a massive bleeding. Do you understand? So pelvic binding is a way of trying to just control that bleeding. You get? So goals of pelvic stabilization is you want to prevent re-injury, okay, from abnormal pelvic motion. If you just leave the pelvis to just be moving, because there's injury, there's a whole lot of dislocation. So if you allow it to just be moving anyhow, okay, it will now form a basis of what instability. You understand? So goals of this pelvic stabilization is there's reduced pelvic volume. All right, you are trying to prevent re-injury. You are trying to reduce pelvic volume to limit the bleeding space. All right, tamponade bleeding from fractured bones and vessels. Then you are trying to alleviate the pain. You are trying to improve the patient's comfort. Okay, so methods of stabilization use a pelvic binder, all right, which can use what a SAM sling or a T-pod. That's how they call them. Sheet wrapping, external fixation, peritoneal pelvic packing. So you can basically pause to look at the details of the devices used, in any of the technique. All right, but just as an overall, just know that they actually do something like this, basically to reduce the bleeding that comes with this. So when to apply the pelvic binding, always apply it when pelvic injury is suspected. So mostly use it in all those vehicle accidents that there's high energy trauma. So it should be placed before decompensation, it should be placed before decompensation is evident. Okay, so special consideration: pregnant or elderly patients require cautious placement because you don't want to compress too much. Obese patients may need 2 belts. Okay, then all right, that's just it. Okay, just so you know that something like this exists, all right, in management of traumas to the pelvis.